All right, good morning, everyone. Welcome to the December 3rd, 2024 meeting of the DDAC. We're going to start today's meeting with just a quick roll call at our various locations. Why don't we start with Albany? If I could ask members present in Albany to identify themselves.
Gary Goldstein, present. Michael Seawriter.
Laura McFadden.
Kurt Lewis.
Kristen Proud. Kathleen Noah. Randy Reyes Castro. Risa Hamlin.
And Jeff Haas.
Good, thank you. All right, can we go to Long Island? We have Long Island on. Anybody joining us from Long Island? Two members have indicated. Is Long Island on? Colleen, do you know if we actually have that location?
Okay. All right, Long Island is here.
Okay, and who's present in Long Island? Is that Jerry?
Yes, and Lynn Kafakis.
Very good.
Thank you.
Thank you. Okay, now let's go to New York City. John? Start with
John
you.
Mulkey. Stuart Plow.
Good morning, this is Willow Bear.
Hi, Willow.
That's okay.
Any
Yeah,
other
you do.
members?
We've got some more.
Okay,
Just members of the council.
Oh, got it. Just kidding. That's it for New York.
that's it for New York? Okay.
Janice Chisholm, also from New York City.
Janice, are you joining virtually?
I am.
Okay, thank you. And did I hear Stephanie speaker in Albany? Albany? Is Stephanie there?
She's not here yet, Nick.
Okay, all right. Now, just from a standpoint of Syracuse location,
Sumantra Sarkar. And Paul Jocelyn.
and I'm joining from Syracuse, obviously, and we have, I think that's all. Did Buffalo join us yet? Let me just check up. Okay, Buffalo is probably not going to be joining us I just got a text. So, virtual members, anybody virtually joining us that's
Yeah.
on the council?
Yes, Leah Steinberg.
Hi, Leah.
Good morning, Suzanne Leving.
Hi, Suzanne.
Good morning, Deborah McGinnis.
Hi, Deb.
Maya Wertheimer.
Good morning, Dan Brown.
Hi, Dan.
Good morning, Helena Schmidt.
Good morning. Anybody else joining us virtually?
Nick and Albany, we also have Tom Avenatti.
I'm sorry?
In Albany, there's also Tom Avenatti.
Okay, very good. Thank you. Great. All right, now, Colleen, could you advance to the agenda slide? Good morning again. So this is the agenda for today's meeting. We'll start with an OPWDD update by Commissioner Bear. I know we'll be also joined by Jim Kaufman, who's going to tell us a little bit, give us an update on the access rule. We'll then allow some time for discussion. We'll then move into the committee reports. We'll continue with some discussion. Sometime during the committee reports, we will take a 10-minute break. We'll then proceed to public comment and then adjourn. Okay. Commissioner Bear.
Thanks, Nick. Good morning, everyone. And thanks, Linda, for hosting us in the New York City location with more people than I think are normally in the location. Nice to see everyone. And happy International Day of Persons with Disabilities. It is an international holiday that I only recently learned about. Every year there is a theme identified, and the theme for 2024 is amplifying the leadership of persons with disabilities for an inclusive and sustainable future. I think it's an incredible theme. It aligns with a lot of the conversations and work that we've been doing. I want to give a special acknowledgement to the self-advocates participating in today's meeting and in all of our forums and various other engagement. Obviously, as well as family stakeholders, but I think our self-advocates showing up and making their voices heard and really incorporating that into the work that we do because of you and for you is so important. So I just wanted to take a moment to remind everyone how important it is to really make space for that voice and to listen to our self-advocates. Our first update sort of relates. I wanted to just give a quick update in the world of advocacy. We've talked about it at prior meetings. One of probably the first thing that I took on when I transitioned into that's a really attractive angle on the camera that I just noticed, so apologies. One of the first things that I sort of took on was this idea of how to better incorporate advocacy into the work of the agency at the state level. So some of the things that we've done, we have talked about, but I'm really excited to let folks know that our Office of Peer Specialists is officially launched and live. So we have a team of peer specialists, that's the civil service title, for people with an intellectual or developmental disability who work for the state. So that team of folks works for OPWDD to do advocacy internally and constituency work. So we get calls from families or self-advocates and we can match them up with a peer specialist to sort of help them navigate whatever it is they're struggling with. That same team of people is providing advice to the commissioner's office as we review policy documents, draft RFPs that are going out, communication materials to make sure that all of the language we're using is accessible and that the graphics make sense to people. And so we're really trying to build that into everything that we do every day. So I'm really excited to have launched that team. We also have a director of advocacy that will start early in the new year. So she will oversee that team as well as work with the new ombudsman program and liaise with the ombudsman who oversees our 2 developmental centers and really bring together all of the advocacy that comes to the agency in sort of one place, so that the advocacy can really be used as constructive feedback and really drive policy decision making in the commissioner's office. So I'm really excited about both of those coming together. It also aligns with the new statewide ombudsman program that I know folks are excited about. So we released and awarded that RFP this year. The new statewide ombudsman program is just about ready to launch. So by the end of the calendar year, you will see an announcement come out with the official phone number, website. We will start making the education outreach materials and make that resource available to everyone. So we're very excited for that to happen later this month. So that's sort of the updates in the world of advocacy. Also coming out soon will be our strategic plan updates. You all know we do these in 5-year cycles, or sometimes we don't do them at all and then we start them in a 5-year cycle. We are more than halfway through this 5-year strategic plan. So we release an annual update every fall/winter. So that annual update will come out very soon. We tried this year to do it a little bit differently, to add a little more concrete sort of language around goals, things that we've finished. There's some informational graphics that have a lot of data in them. And so we're hoping that this update is more sort of user friendly and helpful and just a little more specific. One of the other things that we did differently this year in the annual update is that we decided to include a short-term strategic plan for housing. So every time I went to a 507 forum or any other public meeting, the DDAC meetings, the subcommittee meetings, visits to providers, visits with advocates, other than workforce, housing is the thing that comes up over and over again. We need to do something about housing, both on the certified and non-certified side. And so the leadership team sat for days and we went through all of the feedback that we've received in the world of housing over the last couple of years, the different ideas that have been brought forward, the different concerns that have been raised. We looked at data in terms of who lives in what type of certified housing, who is waiting for what type of certified or non-certified housing. And we brainstormed a list of projects that could be helpful, projects that were already underway, or ideas that have been raised. We then took that list and looked really at what could we accomplish in a 1-year annual update period. So not long-term strategic vision planning, but just very concretely, what could we do in a year to help sort of stabilize the world of housing so that we were in a better place a year from now to look toward a waiver amendment and sort of reimagining what the next generation of housing planning looks like. We then took the shorter list of projects that met all of that criteria and tried to think about what was realistic. How many projects could we realistically complete when you look at all of the other workload of my leadership team? And we came up with a prioritized group of projects that matched all of that criteria. We could do it in 12 months. We could do it within existing resources and workload. It was responsive to recommendations from the residential committee or from provider associations or from self-advocates saying this is what we really need, right? It addresses a concrete issue. And came up with what is our short-term housing strategy. So that is included in the annual update. So I just wanted to sort of flag it ahead of time to give it some context for when you see it. It is still sort of ambitious, but we have started just about everything on that list. So you'll see things like the IT infrastructure and the process to identify and track capacity and vacancies. So we've talked a lot about that project in prior meetings. It talks about the role of state operations and really growing the capacity to serve as a safety net provider for more complex people. So we're doing a ton of work in that space. It talks about reducing administrative burdens for providers in key areas. It talks about the creation of education materials and just enhancing transparency about what exists, what those opportunities look like, how you access them, just sort of better transparency for people about what exists in the system. So there are other things in there, but I just wanted to flag that that's where we came to this short-term strategy that you'll see in that annual update. Obviously, there's a lot more to do in the long-term planning space, particularly when we talk about people who are aging, buildings that are aging, accessibility, a lot of work in how we better utilize non-certified housing, right? Housing is so basic to everybody's well-being and health, right? So a lot of focus coming up to continue in the housing space, but that's just sort of our short-term strategy. What else? Managed care, I was asked to touch base on the managed care report that came out in August from Guidehouse because I wasn't able to attend the last DDAC meeting. Obviously managed care has been a major conversation for the 15 years I've interacted with this service system. It's sort of ebbed and flowed. we spent about $1.5 million in ARPA funding on the comprehensive guidehouse evaluation to really look at other systems in the state, what other states were doing within the IDD system, and to give us some recommendations. So ultimately, I think as everybody already knows, their recommendation was not to attempt a full transition to managed care. And that when I say that, right, obviously there's already a lot of people receiving healthcare benefits within a managed care context, but their recommendation was not at this time to pull in waiver supports or sort of long-term OPWDD supports into a managed care environment. They do recommend a number of other things though that make a ton of sense to me in terms of finding ways to better integrate care. To try to really dip our toe in how do we incentivize outcomes, right? Sort of the idea of value-based payments outside of managed care, which is very valuable and something we definitely are thinking about. How to continue to improve our care management and to better equip our CCOs to manage health outcomes, right? So there's a lot of things that they talk about in the report separate from the recommendation not to move forward to managed care. So at this point, that's where we are. There's a lot of things that I agree we need to focus on in terms of getting to better health outcomes is sort of number one for me. Finding ways to partner to lead to better health access, equity, and outcomes for folks. So that's certainly where we'll be spending energy that we would otherwise be spending on working towards a managed care transition. So I don't know if that addresses the request to talk about it. I know Abiba, when she filled in for me at the last meeting, also spoke about the report itself and the recommendations. We know that I think everybody knows we also have evaluations ongoing in the world of self-direction and in our care coordination organizations being evaluated. So next year, we look forward to hearing those recommendations and feedback. I think a lot of you have participated in those listening sessions, town halls, interviews. And so thank you very much for that. And I think the only other update is we're excited for the next phase of our collaboration with the Georgetown University's National Center on Cultural Competence. So hopefully you saw the announcement go out. The next sort of phase of our work with them is to engage in listening sessions with families of people with IDD. So self-advocates is a separate piece. This is specifically for family members, and it's for any type of family member that has experience trying to access services or experience with receiving services. And they're really interested to hear from a broad range of folks on that. So those listening sessions will happen in January and February. And so we can follow up with what Georgetown sort of recommends when they wrap up their work next year. I think that's it for me. We were asked to touch base on the access rule, and I would quickly get out of my depth and say things that are wrong. So I've asked Jim to just give kind of a high-level overview of where we are with the access rule and just sort of a reminder about the major areas that CMS has said they're going to require as we transition to that rule. So I will turn it over to Jim.
Thank you very much. Okay. Okay. I haven't had breakfast during this. But good morning, everyone. And for those of you who haven't seen or heard from me yet, Jim Kaufman, Deputy Commissioner for Policy and Program Development at OPWDD. So just in terms of the access rule, we'll sort of give the high-level overview of the major components as we've done before, but it's certainly a good opportunity to refresh those points again, so everyone's sort of hearing them, getting familiar with what those are. But more sort of specifically, one of the things we'll talk about is the fact that we are still awaiting sub-regulatory guidance from CMS. That the first sort of stage of that sub-regulatory guidance is set to come out in early 2025, so we eagerly anticipate that information, which will help us sort of dive in at an even lower level of detail and really start to bring forward decision-making processes as well as more in-depth stakeholder engagement opportunities. But what we have been doing, and we'll touch on, is a tremendous amount of internal sort of organization work so that we're structured appropriately to work on each of the major components of the access rule, with the appropriate lead and expertise within the agency, and build out a structure that will facilitate, appropriate communication and channels for raising decision points and making those decisions going forward. So we'll touch on those, but just again, to high level, sort of touch on the access rule itself. Should I just say next slide? I guess the first slide. So just in terms of the outline, pretty much what I just discussed, high level summary of the access rule and timeline, steps to support implementation, and as noted, an overview of our program management and governance structure. So the access rule, high level. The final rule takes a comprehensive approach to improving access to care, quality, and health outcomes, and better addressing health equity issues in the Medicaid program, and specifically in the home and community-based services programs, which OPWDD largely operates under. These improvements increase transparency, accountability, standardized data and monitoring, and create opportunities for states to promote active beneficiary engagement in their Medicaid programs, ultimately with the goal of improving access to care. So the next slide or two, we'll just touch on, again, those major components that are in the access rule. So in terms of grievance system, states must set up a grievance system to respond to quote expressions of dissatisfaction or complaints related to state or providers' performance related to person-centered care planning requirements and the HCBS settings requirements. This includes, it's not limited to, but includes having written grievance policies and procedures that require resolution in 90 days, preventing retaliation and punitive action against the filer, reviewing resolutions if the beneficiary is satisfied through an appeal process, ultimately monitoring the process and making information available to CMS on request. Person-centered planning applies performance standards to the requirement that reassessment of functional need and person-centered planning occurs every 12 months. States would be required to demonstrate that they reviewed the PCP and revised the plan as appropriate, and that's an important point, based on results of the required reassessment of need every 12 months for at least 90% of individuals who are continually enrolled in the state's HCBS programs for at least 365 days or longer. Additional clarifying language includes, as noted, as appropriate based on the annual function need assessment. This clarifies that changes to the person-centered service plan is not required if the reassessment does not indicate a need. Incident management system, new section to state assurances. The state operates and maintains an electronic quote incident management system that identifies, reports, triages, investigates, resolves, tracks, and trends critical incidents. Quality measurement. States will be required to adopt the HCBS quality measure set. HCBS quality measure set is intended to promote more common and consistent use within and across states of nationally standardized quality measures in HCBS programs, and to create opportunities for CMS and states to have comparative quality data on HCBS programs. Didn't flag, but off to the right, we have the various effective dates. So just going back a little bit, grievance system is the first one that's up in terms of the compliance requirement. That's all of these are based for the most part on July 9th, because that was the date this year in which the final rule promulgated. So July 9th, 2026 for the grievance system, person-centered planning, July 9th, 2027, incident management, July 9th, 2029. And HCBS quality measure set actually has a number of nuances to it. It's staged over multiple years, beginning in 2028 through 2032, but there is also an early adopter option for states. And we're currently working with the Department of Health as to whether we will be an early adopter state. As the money follows the person state, We, again, typically the state through the Department of Health has typically been an early adopter for various measurement set requirements. And it may be done so again through the lead of the department. So one of the areas that we are currently working on, we're working sort of across the aisle with the Department of Health where we can to sort of collaborate on the various pieces that they, as the lead state Medicaid agency, make capability on. So quality measures that report is one of those areas. HCBS payment rate disclosure and adequacy. So states are required to publish their payment rates for these for HCBS programs in the form of an hourly payment rate. This is actually technically the very first thing that is due within the access rule. It is uniquely due on July 1st, 2026, and those will be based on rates that are in place as of January 1, 2025 or June 30th, 2025, whichever is. And again, that's taking existing rates and converting them into an hourly form. Just in terms of payment adequacy, so there's a couple pieces of the payment transparency and adequacy rule that do apply to OPWDD direct support professionals and some that don't. The payment transparency, the reporting requirements are applicable to OPWDD direct support professional. And this was one of the pieces that was added. Habilitative services was added in the finalization of the rule this past July. So this provision is extended to include habilitative services, thus applying to the OPWDD HCBS waiver. This will require OPWDD to report on the levels of Medicaid funding for habilitative services going to direct support professional compensation on a provider level basis. Now, one of the pieces we don't yet fully understand, and hopefully we will through sub-regulatory guidance. One thing, well, I should say, we know that the definition of direct support professional is broader than our specific direct care worker title series. So it includes some titles that will reside within the sort of 300 series from a reporting standpoint, if you're familiar with that. So that gets into some of our clinical titles, not all, but some. So it's a little bit broader than what we would more narrowly describe as our direct care worker. And again, with some additional sub-regulatory guidance, we should be able to hopefully detail that out more specifically. The piece that's not applicable to OPWDD at this time, although anything could change in the future, it may be, is the payment adequacy requirements. This applies to personal care, home health aid, and homemaker services. It does not apply to habilitative services at this time. So this is not at the moment in terms of ensuring and requiring that 80% of payments are provided to direct support professionals. It currently does not apply to OPWDD. From a reporting standpoint, OPWDD and its providers will have to comply, but from an insurance standpoint, it is not yet, and maybe it won't be, but at this time it's not yet. So in terms of access reporting, access reporting includes habilitative services in the final rule. This will require coordinated IT systems to develop to perform the needed tracking and reporting. Annually report, this will require states to annually report on the percent of authorized hours for homemaker services, home health aides, personal care, and again, here's where it applies habilitative services that are provided within the past 12 months for statistically valid sample of individuals newly approved to begin receiving services within the past 12 months. Go on to the next slide, please. In terms of website transparency, states must operate an accessible website that includes required reporting on incident management, critical incidents, person-centered planning, service provision compliance data, data on ECBS quality measure set, access data, and payment adequacy data. There's also an interested party advisory group provision which will require states to establish an interested parties advisory group that must meet at least every 2 years to advise and consult on fee-for-service rate aid to direct care workers. Some of these provisions, we've already taken, a very close look at. We still require some additional sub-regulatory requirements that will come out from CMS beginning in early 2025. In some of these pieces, we are also reaching out to and collaborating with DOH on to make sure that we understand where they will be as the lead Medicaid agency. In past practice, some of the final rule requirements that CMS has issued, the department has delegated most of the oversight and compliance responsibility to our agency with centralized sort of reporting expectation that will come along with it. So we're currently in discussions with the Department of Health to understand where they are in terms of their review of the access rule, and so that we're aligned and collaborating with them in that work as necessary. So move on to the next slide. That's sort of the high-level overview of the access rule and the major components. Again, we're sort of working with the final rule information and a somewhat limited set of information that's been put out by CMS thus far, but hopefully much more and more detailed information is to come. So this is just a slide noting the broad timeline. So we're currently in 2024, the rule has been finalized, promulgated. Beginning in 2026, the grievance system will be required. Beginning in 2027, access reporting, person-centered planning, wait list, website transparency. 2028, HCBS quality reporting, but again, some of the provisions as an early adopter state may come sooner than that. Payment transparency, and then in 2029, incident management. So just in terms of how we have organized as an agency around, our support of implementation and compliance requirements, states, as noted, are currently waiting sub-regulatory guidance from CMS, anticipated beginning in spring of 2025. Absent this sub-regulatory guidance, certain detailed requirements of the access rule remain unknown. But as noted, since July 2024, when the final rule was effectuated and promulgated, OPWDD has been developing a project management approach to organize itself across divisions to ensure divisional responsibilities for the access rule are established by major component, and communication loops are made redundant to ensure recommendations and decision-making for staff. The overarching goal is to develop work plans, timelines, support needs, and a strategy outlined by the end of spring, beginning of summer 2025. This strategy outline will also include a plan to establish regular and targeted external stakeholder activities to ensure dialogue and input, including with the DDAC. So just to sort of take a step back for a second, over the last 4 or 5 months, we've been meeting on a near constant basis, both to look at specific aspects of the rule, but also to come together as an organization and as a leadership group to develop an appropriate structure that's going to be consistent and standardized in a way that once we start to receive the sub-regulatory guidance from CMS and we are able to make more detailed decisions, we are also making progress towards an opportunity that will be a little bit more inclusive and available for stakeholders, including the DDAC, to sort of come together as a group and be a part of those discussions as we make decisions and any processing change, policy changes, et cetera, that may come about as a result of the access rule. Just on a sort of more technical standpoint with respect to program management, again, we're working internally with our enterprise program and management office, PMO. They're providing internal support to organize activities and decision-making with respect to the access rule. We've established separate monthly meeting cadences for project management, strategy, and executive and commissioner level engagement. We're just looking at the chart here going left to right. So we have sort of our access rule executive report out. The purpose of this is to provide program status update, escalate major decisions, issues, risks to executive leadership to the commissioner. This sort of flows from program strategy, meeting structure, where the purpose is to coordinate and align key stakeholders on goals, strategic direction and priorities. This includes IT strategy, data and reporting strategy, engagement and communication with external partners, including external messaging, funding strategy, alignment with operations, understanding the impact on agency operations, and alignment across all components of the access role. So that's sort of the core meeting structure. And then at the more program component level, we also have monthly lead and project management meetings. Each percent of the work completed and planned for the next month, identifying risks, issues, and driven by the development of work plans. We have developed charters and work plans for each of the major components of the access rule that's helped driving the issues, including not just the obstacles and the barriers that we may see in front of us as we work to implement each component of the rule, but also resourcing IT, system build, system enhancement, things like that. So it's all sort of being put together in as organized and as comprehensive as a way as possible, so that we're building something consistent and standardized for us as an agency to make informed decisions, but also eventually to bring in our external partners as well to be a part of those discussions as appropriate. So that's what I have for the access rule. I hope that was helpful. I tried to sort of balance, an overview of the rule itself, which is always helpful to talk about. And of course, we do wish and are eager to receive some more detailed information from CMS, but wanted to let everybody know that absent that information, it has not come at the cost of us as an agency putting forward a very sort of tremendous amount of internal work to organize and set ourselves up as best as possible to be accomplishing what is a very sort of significant task, which will be over the next several years, over the next decade, and complying with this rule. And I would just note, with the timeline that was shown in here, while some of these components may be several years out, 2028, you really need to be thinking about these things, much earlier. So, again, grievance component is the first one up. We're heavily engaged on that. We're working around, existing and enhanced processes that we have established to comply with that. We're talking to the department. We'll keep doing that for each and every week.
Thanks, Jim. So I know that the Wi-Fi in the New York City office was coming in and out. I think that other folks were able to hear Jim. We will share the slides if that's helpful for people to have. I mean, at the end of the day, I think the takeaway is that, yes, it is a big rule. Yes, it will require a lot of changes, both from the state and from providers and everyone. We keep hearing like, aren't you working on this? Aren't we going to talk about it? This is a big deal. And this is sort of our attempt to say, yes, we are talking about it. Yes, we are watching it. We are aligning ourselves. We're figuring out as the state where we need to make and leave space for significant investments in the world of IT infrastructure. It is definitely something we are focusing on. Once we get any of that guidance that Jim mentioned, that would be the time to sit down as a family group and talk through some of the logistics. So very much on our radar, a lot of work being done, so much more to come. I think what we don't know is if and how any of the access rule or timelines could change in a new federal administration. So also something we are keeping an eye on. So we will make the slides available, and thank you, Jim, for walking us through it. That was all from OPWDD. So I don't know if you want to. Nick, I'm looking at John. I'm looking at Nick.
Yeah, no, that's okay. I will. Thanks, Jim. That was a very helpful update. I just want to open it up. We've got some time on our agenda to open it up for discussion, either on some of the points or topics that the commissioner shared with us or Jim shared with us on the access rule. So we're just going to open it up for discussion. If you could make sure you identify yourself before you speak, so that we know who is speaking.
Good morning, Nick. This is Suzanne Leving from Franklin County. And thank you, Commissioner Bear and Jim, for your presentation. In terms of the safety net provider that you identified in the short-term strategic plan for housing, how do you foresee OPWDD functioning in that role?
That's a great question and something that we're working through articulating as part of that short-term strategic plan. So when I say safety net, what I mean is really trying to transition state operations to become a provider that's sort of last resort when our voluntary community are unable to meet someone's needs. So this could be someone with potentially complex medical needs or more likely complex behavioral needs. So state operations has been doing a lot of work thinking through how to resource certain homes clinically to support people with more complex needs. In the last year, we have opened 6 transitional homes. I don't know that we've done a great job of talking about that publicly, but we've opened 6 homes that are dedicated to taking people mostly from residential schools and similar locations where they have very complex needs, moving them to those transitional homes where we have the ability in state operations to really wrap around extra clinical support and then transition them to a community home, either in state operations or in the voluntary world. And we've been really successful within the last year of moving a number of individuals that way and transitioning them to sort of stabilize and then flow them through the system. Also things like the partnership with Kings County Hospital and the ETU, right? So using state operations as something we know contractually, and I know it's a source of contention, right? That our DSPs and clinicians in state operations get paid more under the contract, and really trying to take that more expensive service model and use it to be a last resort provider for folks that are harder to serve everywhere else. So when I say we put in our strategic plan how to really articulate and make true that promise to be a safety net provider, that's what I mean. And I have been pushing state operations very hard to show me that the acuity and the needs of folks that are moving into state operations is changing. So we have people in state operations that have been overserved there that don't need to live in that type of a last resort provider. Not kicking people out, certainly, but just in terms of who's coming in now, making sure it is a harder to serve population. Does that help answer the question, Susan?
Absolutely, and thank you very much. And I think it's definitely a helpful approach when we have individuals sitting in emergency departments waiting for some place to go. And so if transitional homes include that clinical umbrella of services to support someone, it's a fantastic idea. So thank you.
Thanks for the question.
Thanks, Suzanne. Other comments?
Hi, Nick, it's Mike Seawriter in Albany. 2 questions / comments, if I could. One for Jim, but I think it's like everybody, right? On the access rule, I mean, I think that there's widespread speculation about whether this rule is going to stand with the new administration of the federal government. We're past the time period in which Congress can do wholesale action to rescind any pending or recently enacted regulation. I think that would require CMS to actively proactively rescind the access rule if they wanted to do that by putting it in public register and doing comments and all that stuff. Is that also consistent with your understanding?
Yeah, Michael, that's exactly right. So the way in which and the timing in which the final rule was promulgated avoided a congressional look-back opportunity. So yes, that has been avoided. So that is not an automatic sort of congressional opportunity to look at this final rule. It would have to come from CMS is the best understanding we have of the operational procedures as it relates to this rule and the incoming Congress and the administration.
Great, I think we're consistent on that. I appreciate that.
I'm fairly certain, and in fact, it is a point that has been sort of discussed and confirmed with some of the the federal legislative experts that we have and some of the organizations that we work with, NAS is included.
Anchor as well. That's just, I'm appreciative of the fact that we're all on the same page on where this stands and what the the dynamics of this moving target are. One other comment, I think more for Willow and for Jessica, I just want to commend you on the components of the 507 plan that you're talking about in relation to housing. The 507 plan is something that was neglected and frankly discarded for 10 years with OPWDD. And the fact that you've picked it up and you are starting to move down that process and trying to make it into a more mature planning process. I commend you on that. It's not going to, you're not going to get to a 5-year plan right out of the gate. That's not how it works, right? You've got to build toward it. In an iterative way, like I think you're doing here. So I'm really pleased to see or hear that you're, where you're focusing in a 1-year period of time, try to take a step toward more in the future. I'm very excited to read it when it's released.
Thanks, Michael.
Thank you, Michael. We have a question here in Syracuse, Paul.
Hi, Commissioner. This is Paul Johnson. Thank you for your time this morning. Wondering if there's anything you can comment on regarding the Empire State Freedom Initiative. I know this is a governor's initiative, but as I'm sure you can imagine, there's growing concern about the change in federal administration and the impact that might have on the civil rights of people with disabilities in the state. Anything you can share on that?
Yeah, I don't have anything to at the moment on the Freedom Initiative, other than I'm, excited that the Hochul administration is proactively reviewing what could be under attack in a new federal administration. And certainly we have every intention of remaining part of that conversation for our service system. Beyond that, no, there's really nothing else to say yet.
Thank you for that, though.
Thanks, Paul.
Tom Ebenanti from Albany. I've got a couple of questions. First of all, I appreciate the work that you're doing. I think you're moving in the right direction. But as a parent and as a spokesperson for people who have a family member in the system, I want to express a bit of frustration over the slow progress. Let me start with the website. There was some discussion about the website. Frankly, I don't understand why we don't just adopt everything that's been proposed as state rules. Why wait for the feds to push us? But with the website, I'm a little concerned about the content of the website. For example, somebody asked me and said, what are the regions? What are the boundaries? How do I find them? Not on the website. I can't find it. They said, well, how do we contact the regional directors of each? Can't find it on the website. Maybe it's my inability to maneuver the website, but I found some of the information by Googling it and found it elsewhere on the state website, but not on OPWDD website. But if we're talking about accessibility and we're talking about transparency, I think our website should be very easy to maneuver and some basic information, like who is running OPWDD if you have a problem or a complaint, who do you call, what are the regions? Who's the director of each region? All of those types of basic, simple information that parents and family members need. I don't see that, and perhaps afterwards, if it's on there somewhere, somebody can tell me where. But I couldn't find it on the website, and others couldn't find it. The second thing is on housing. Again, I appreciate the plan, but if we're going to, and I think you're moving in the right direction by moving. By making the state operations more for people who have more complex needs. But my question is, how many certified housing units, beds, whatever you want to call them, were in existence at the beginning of this year, at the beginning of the year before, and today? Are we getting more or are we getting less available beds? My sense is people can't find beds. It takes a long time. And the crisis hasn't been solved. So can anybody now give me a number of how many certified beds, units, whatever you want to call them, there are in the state today, and compare that to where they, this time last year and the year before? And what is the plan? What are we going to do to produce more beds immediately?
I talked to People Inc. last week.
Well, let's get an answer from OPWDD, okay? You and I can talk later.
So Tom, this is Willow, and unfortunately our audio is going in and out. I think I captured the general sense of what you're saying, but feel free to tell me if I'm missing something. So your first concern related to website content, we definitely are working on updating the website. I've actually had some really great compliments recently about new information website. As it is an open project. There is a lot of new data available and making things more accessible. There's an 800 number that anyone can use, and it will connect you to whichever region you want, but the regional numbers are still there. And we can link that in the chat if someone hasn't already done that. I mean, families should go to their care managers first and foremost, right? So that should be a first point of contact, understanding that that's not always an immediate solution or successful, because I'm getting looks around the room, but that certainly is where you're expected to start. In the terms of housing, I heard concerns about a lack of available beds in the certified system, obviously a perennial issue. It sounded like you were asking for numbers of vacant beds. I think we've done a number of presentations on the reasons why that data is not immediately accessible or accurate, right? And that is the reason we've undertook this massive project in capacity management and building that system so that we have a more accurate representation of opportunities that are available, that have staffing, that are appropriate for the people that need them, are barrier free if someone needs barrier free, right? So we have just a very antiquated way of tracking that, and have done an incredible amount of work and a really large IT investment to fix that. And so I think this time next year, I'd be able to answer that question with much more accuracy. And it's just a process that takes some time. And I'm not sure what else you asked because our Wi-Fi was going in and out, so I apologize.
I'll try again. On the website, are you telling me the information is in fact there? I just can't find it?
Yeah, Tom, if you look in the chat, and I'm sure we can send this, I know you're in the meeting, so you may not have access to it, but the org chart is on the website with the regions identified, the contents for each region. And I know
Well, if you go to the search function and you put in regions, it doesn't show up.
Yeah, go into About Us. So we can take that offline. But it is now posted for everybody. It's in the meeting. Jennifer posted it and it's not.
And then on the question of housing, so we don't know how many certified units there are either in the state operating system or in the private sector. And so your goal of moving people, of setting up, making the state operations the housing of last resort. We don't know that there's even enough units out there to move people out of the state operations into the voluntary system, do we?
Yeah, and that's not the goal, right? That's not the goal of the safety net initiative, is not to move everyone out of state operations into the voluntary world. It's to provide a higher level capacity as the state for individuals who have such complex needs and behaviors that our voluntary providers find themselves unable to safely meet that need. And so these are the folks that tend to stay in residential schools for a long time, tend to find their ways to hospitals, which is never an appropriate living setting, right? So to provide an alternative opportunity for as many of those types of complex individuals as we can. So that is
I understand
the goal of that initiative.
Appreciate the goal and agree with it, but as somebody on an advisory board who's trying to be helpful, I have to have some measures against which to make recommendations. And if I don't know how many people are in each category and what the resources are, how do I then make a recommendation and be helpful? I think last time we asked for a report on what the budget proposals were going to be. And I haven't seen that yet either. I mean, if we're gonna be an advisory board and make recommendations and then lobby on your behalf with the legislators, we have to have some information in advance. And I'm sorry to sound so frustrated, but I'm hearing it from the community over and over again as a member of the disability community, and that community is very frustrated. So I'm looking for information to bring back and assure them that OPWDD hears them and is moving forward. And I'm not getting any data to be able to bring back to them. So I appreciate your efforts, but I'm just saying that I'm not finding any information to bring back.
Okay, thanks, Tom. We have a question here in Syracuse, Paul.
Yes, Commissioner, hi, Paul Johnson again. I just wanted to thank you and for the update you provided on the guidance report this morning, and also to Jim for his time with the Health and Wellness Committee recently to provide an update. I'm just wondering if Jim could provide the council with a little bit more information on what might be the next steps with regard to the guidance report. I know that there's a lot involved in assessing what they did recommend, and I think it'd be great if the council could be involved in those conversations to the extent it makes sense. And a little bit more information to the council itself might be helpful, if that's okay, if possible. I'm sure you heard that.
Could you hear that question, New York?
I heard the question. This is Jim.
Okay, Jim, can you respond?
Yeah, so I mean, I think with respect to the Guidehouse report, as the commissioner noted, it has some, some very clear recommendation as to sort of what not to move forward. And it has options for ways in which we may move forward, but we're really still, just like all of you are, hopefully, in reading the report, in an evaluative state as it stands. There's nothing planned for us to be doing, from an implementation standpoint with respect to the report immediately. But we are looking at it. We're trying to understand it, collectively as an agency so that we can use it as an informational tool for things we may want to consider moving forward. And anything we do ultimately on that front, we would do with outreach and discussion with and consultation with DDAC and other stakeholder entities. But we are, as it stands, in an evaluative state, and we would recommend that you be in that state as well. Please read the report. Come to us with questions, and we'll do the best we can, to answer those questions in whatever detail we can.
Hello, this is Stephanie Speaker. I talked to people last week. They told me that they have the beds to give out. They said that the only thing is OPWDD won't let them give out those beds. So how do I get more staffing for the group homes, and how do I get people that don't have families places to live?
I know New York is experiencing some Wi-Fi issues and sound issues. Stephanie, why don't, if we could, I'd like to propose that we take our break early, give New York an opportunity maybe to log out, log back in, see if we can fix their audio. And then we'll start up, Stephanie, with your statement when we resume. And I'd like to remind all sites to, when you're not speaking, to keep yourselves on mute, because we are getting a little bit of background noise, which is also, I think, making it go out. So we're going to, right now, it's 12:03. We'll start back up at 12:15. I'm just going to do a roll call of the sites. Do we have New York back on?
Everybody was on.
Is New York on?
Yes, we're back, Nick.
Okay, so we have,
Long Island's here.
hold on a minute. We have audio for New York. We do not have visual. Okay, Long Island, Jerry?
Yes.
Okay, great. Albany, we see you. Can you hear us? Okay, great. All right, and then I'm not gonna go through, but I don't know if we actually even were able to bring Buffalo online. All right. So John, in New York, we will pick up with Stephanie's comment. Stephanie, are you on? Can you hear us?
I can hear you right now. Okay, I can hear you.
Could you restate your comment before we took the break?
My comment was that, I talked to people they said that they have the beds for the people, but OPWDD won't let them, give those beds out. And how would I get more staffing for the people that don't have families that have to go into group homes?
Yeah, hi Stephanie, this is Abiba Kindle from
So,
OPWDD.
it seems like our Wi-Fi issue in New York City has not gotten better. It sounds like the question relates to the sort of process back and forth between OPWDD and the regional field offices and local providers. So I'm going to ask Abiba if she can jump in here to address.
Sure, Commissioner, can you hear me? Can folks hear me?
We can.
Okay, great. Hi Stephanie, this is Abiba Kindo. I just want to talk about the process more broadly. I think, certainly our regional field office can engage specifically with the provider that you referenced to better understand their circumstance and the experience that you just shared with all of us. Certainly, if individuals are interested in seeking housing or residential supports, we've articulated that process really starts through the care planning process with their care manager, identifying those specific needs. The care manager would then work to submit a referral packet to the regional field office, identifying the specific need. And then we would essentially process that referral through our certified residential opportunities process, including looking at the specific need, identifying a designation based on the circumstances, the individual circumstances, or that of their caregiver, or other variables that impact one's ability to reside independently. So there is a process for folks to follow. I think more broadly, what we've heard from providers, I don't think that currently the issue is really about vacancies. I think it's more about the availability of staff and resources to be able to fill some of those opportunities. But I think that what you'll see is as we move forward during the course of the next year in building out the capacity management application is a parallel process where we'll be working with providers to better understand their vacancies, where vacancies need to be repurposed, a deliberate effort to really sort of clean up those opportunities so that we can understand what additional opportunities may be needed in the system. And typically when we have a better understanding of that, we work to issue a request for proposals where we solicit interest from providers who are looking to meet the identified needs that we've stated in that proposal.
Thanks, Abiba.
Thank you, Nick.
We're now going to move to committee reports. And we'll start with residential, Kirk and Dan.
Hey, Feroz. This is a question for Willow and Abiba. On the state ops being safety net provider, a few years ago, there was an excellent concept, I thought excellent, it's an initiative called Flow. And it was designed to identify people living in state ops that maybe didn't need that level of management and care, that were already connected with the voluntary provider to see if there was an opportunity for them to move. It was a really great idea, and just speaking for us as a provider, we had about 30 people or so on, on that list, and I think only one or two ended up materializing as somebody that did move. So there were, the process could have worked better, and I guess I just want to suggest that maybe we try it again and, evaluate how it worked, so we can maybe make some progress there.
Thanks. I remember the Flow initiative from the last time I was at the agency, and I think it's a great suggestion to take a look at it. It happened while I was in the governor's office, so I'm not sort of familiar with how it all turned out and the outcome. So it's a good reminder of a potential tool. Thank you.
Thanks, Jeff. We're going to now transition to committee reports. I'd like to call in Kirk, Dan, for residential.
Thanks, Nick. Yeah, this is Kirk Lewis in Albany. The residential committee continues to meet. We missed November because of holidays and schedule conflicts, but I was really pleased to hear the commissioner's report on the short-term strategies for residential, because I think that's where the committee's going to take a kind of a reset in December, kind of take a look at what should the priorities be for the committee, what should we be looking at, and I think we want to hear some of the same data that you were talking about. Again, it goes to Tom's questions as well as to, where are the openings, what are the openings, what are the needs, where should the priorities be? So the committee also, we worked on a charter. The charter was approved by the executive committee of the DDAC, the last DDAC meeting, last DDAC executive committee meeting. So that's kind of a touchstone for us as we move forward. We welcome some new members to the committee. So again, we're looking forward to working with you, Commissioner, and with your team, and moving forward, and, trying to work together to achieve some of those goals.
Thanks, Kirk. Any comments, questions for residential? Okay, let's go to Children's Services Committee. Jeff and Randy.
November 7th, and we had, great attendance, great engagement. This committee is really developing very well. It was the first time we were able to get Suzanne Bowling to attend, who's does policy work in the state education department. And we had more on the agenda, but honestly, it was such a great discussion, and we felt that we could have been there for another 5 or 6 hours, really laying the groundwork for, the rest of our work together. So unfortunately, the recording of the virtual meeting is lost at this point. I've got a tech guy who's trying to work on it, but I want to make sure we get that, because there's a lot of great detail, coming out of it. So, and that's really at this point.
Thanks, Jeff. Any comments, questions for Jeff and Randy? Okay, let's go to Health and Wellness. Gary and Paul.
Hi there. Our committee has been meeting. We spent significant time reviewing the Guidehouse report and trying to understand what it meant. And what came out of that, our discussions is, okay, we have the report, what's next? And I think that was somewhat addressed today. In terms of health needs, and we're talking about, in this regard, access to care for medical and dental providers, psychiatry, complex, people that have complex cases. And I like the idea that OPWDD is moving to a project approach and doing it with housing. There's a lot has taken place, and there's been a lot of cooperation with past commissioners and OPWDD with DOH, trying to improve payment structure for anesthesia, say dental anesthesia, et cetera. But I think at this point, we thought maybe the Guidehouse report would give us a little more guidance on how to proceed and make things happen on the ground. because services are just not, they're sporadic. Some parts of the state, they may be good, in other parts of the state, they're horrendous. And so I think a tactical approach, spending time, I'd love to sit down and hear exactly what the plan is. Do we need to upgrade the Article 16s? Jill Pettinger is working on geolocation system to figure out what services are where throughout the state, currently in the 16s. And we requested that they make sure they include the 28s that treat people with disabilities, so we know the data on what's happening. It would take constant updating over time, if that's something that needs to be done. But perhaps a tactical plan, so that this time next year, we could turn and say, yes, these things have completely been done to improve access, and we can, have something to show for it. Otherwise, I fear this is going to go on and not necessarily make a difference. Sumatra, would you like to say a few words? I brought Sumatra down to Great New York Dental meeting on Sunday, and we met with resident directors from throughout New York State. Sumatra, and this goes to the advocacy. I think that when it comes to medical and dental advocacy, we should be engaging more of the actual advocates and bring them down to meetings and what we need to as part of a strategic plan to create awareness. Sumatra, do you want to perhaps say a few words?
Yes, thank you, Gary. Thank you so much for taking me around. For me, it was a new place, so I didn't know, but I was talking to Nick today morning, and I was telling him that I think we need people, and what you rightly did is we were talking to the dental colleges, especially the medical colleges, who can help us out in having more dentists for the special needs. I mean, I can tell you from my son, we have seen a dentist for the last 2 years now. So we need people to advocate in this field, in all fields to be precise, to have doctors, physicians to help us out. And it was a wonderful experience for me to listen to you, to talk to them, to advocate for more dentists to help special needs children and kids around. That was nice. Thank you.
What I'm alluding to is events like that, where we have opportunities throughout the state as part of a strategic or tactical plan. We'd be more than happy to work on our dental task forces, work on medical groups with OPWDD to let everybody know what you're doing, what's been happening, because you're doing a lot. I think OPWDD has done quite a bit, been very interested in trying your best, but I think we should consider going to that next level. I know there's a choking prevention initiative going on. Haven't heard much about it here. I don't know who knows about it. I don't know if it's running into issues, if the implementation is good, but we'd like to get somebody to kind of report to us on that and discuss any obstacles to it, how the feeling is, if there are any new regulations or ADMs coming out relative to that we might have missed. And Teresa Hamlin has been working on the complex care part of our committee. You want to say a few words?
Sure. Thanks, Gary. So the Complex Care Committee met late September. It's a really great committee because it not only has folks from OPWDD, but we have folks from skilled nursing facilities under DOH and Haney's representatives. So we're gathering a lot of information. There's been a lot of work done on complex care, in New York State as well as across the nation. So we have lots of reports that we're reviewing, looking at the gaps in services, and we hope by the next meeting to be able to really understand where we need to go in terms of strengthening the supports for this group that, is only growing in number right now, just given the terrific medical care that these folks are getting. But they're not being serviced well across the nation. So if we can gather some information and make some recommendations, that's what we hope to do.
Thank you. We did go to a monthly meeting format, but I think that it's affecting our attendance. So because I think a monthly meeting might be a little, unless we really have some exciting things that are happening, to get everybody together. So we're going to discuss the frequency of meeting a little bit. And I want to encourage anybody here to please, if you're on the committee, attend the meetings and provide input and learn from the various speakers we have, so that we don't necessarily have to repeat information. So, thank you.
Thank you, Gary. Let's move to employment and meaningful activities. And I know Susan, we all know Susan retired. And Shamika, I don't think is on, but
We have a question, Nick, from New York for health and wellness.
Okay, very good. Let's back up then.
I'm Hans. I'm from Adapt Community Network in New York City. Is DME services discussed in this committee? I've heard a lot of reports from South Africans, from people supported, that they're having issues accessing DME services, that it's being cut down, that the quality has worsened.
Little trouble understanding the question. I'm sorry. You can
So that's
Durable medical equipment services like wheelchairs and prosthetics.
Durable medical
braces. Yeah, I was wondering if that's part of the discussion, because there's a lot of reports from South Africans and people supported that those services are being cut down and the quality has gone down. The options are more and more limited.
I will tell you that particular topic is not one that I heard discussed at the medical task force, certainly not the dental, nor at the committee meeting. So I would like, if you can come to our next meeting, bring it up, and let's dive in and take a look at what the issue might be here. Does anybody have a thought?
I know that we're experiencing some issues in terms of DME and Medicaid reimbursement for some. There's been some elimination of services. I knew that.
And is this on the HMO side, on a Medicaid, straight Medicaid?
Straight Medicaid side is what we experience.
Okay, let's bring it up as a topic of interest if we can. Okay.
Yeah, and I can recommend some South Advocates who are experts in this.
That'd be
Not
great.
necessarily one, but I can definitely recommend some people.
Have them call me and we'll get them on the agenda. Invite them.
Thanks, Gary. Any other questions for health and wellness? Okay, now let's move on to employment and meaningful activities. As I said, I don't think Shamika is with us. Is there a member of the committee that may be able to give us an update? Jerry, Jeff?
Nick, this is Jeff Fox. Shamika sent me a report and asked me to read it for her.
Great, thanks, Jeff.
So there are two standing recommendations. Just as a reminder, OPWDD to create a roadmap for transition to pre and supported employment. And OPWDD should include plan for employment, entrepreneurship, and life plans. There are a couple of key projects that OPWDD has been working nicely on. Updated OPWDD employment and vocational services webpage for people with disabilities, families, and agencies. There's also updated brochures. And there's updated website information videos for businesses regarding hiring people with disabilities. There's an employability pledge initiative. And one of the things that she's suggesting is that when you pledge, the list doesn't distinguish between providers and businesses who are looking to employ. So it looks like that's a suggestion she's making. There's an employment conference coming up March 3rd through 6th, sponsored by WIHD and the University of Rochester. And then she's got a couple of 5 key concerns. Despite all the good work that is being done at the OPWDD level, some families and individuals still struggle to navigate the systems to achieve competitive and graded employment. We need better coordination between school districts and employment options during transition years. There's too many myths around losing benefits if I work. We may need advocacy at the federal level. Amount of paperwork to comply is a disproportionate burden. Customized employment, which is the gold standard for the IDD community, is essentially not done to fidelity in 95% of the state. Few employment providers have been trained with an ACR approved curriculum. and finding we need additional initiatives to teach more businesses how to work with the IDD population.
Thanks, Jeff. Questions, comments?
Can I make Tom Evan, can I make a request? Maybe the committee has already done this. I'm not on this committee. But one of the concerns that I've heard is that ComHab staff is very restricted in how they can be helpful to people who are seeking employment and then getting employment. That's what I've heard back. And perhaps the committee can take a look at that, see if there's any truth to that, and if they can make some recommendations on how to open up the regulations so that ComHab staff could be more involved in someone who's getting employment.
Thanks, Tom. Okay, self-direction. Stuart?
Thanks. Yeah, thanks, Nick. I'm in New York City, and I hope everybody can hear me and we're not breaking up. Can I confirm that I'm not breaking up on your end?
We can hear you fine.
Okay, good. All right. So happy holidays. And I'm really excited that this room is filled here in the city. I haven't seen this for a while. And I think it's a good omen for 2025. I wanted to mention just a couple of things and not get too into the weeds. When we talk about self-direction and our committee, people have a very high expectation for us to meet all of their individual needs and struggles, and that is not the purpose of our committee. So I'd like to share with you that one of the highlights of our year has been the frequent and quality conversations we have had with OPW. And I'm going to use OPW as the acronym to include working with the Office of Strategic Initiative and all of those folks, as well as Angela Chad. It has really been remarkable. And I think for those who have expectations for us, I think we're at a turning point. And I think the turning point is that we do more and deeper conversations. But initially our concern was that we weren't communicating. And now I can tell you that there's communication more than one would expect. And for example, knowing that this meeting was occurring today, just over the past couple of days, there was such a high level of activity. Some people were not on our committee, but I know from public comments that I saw that people were complaining that the Guidehouse survey went out over a holiday weekend. But I think even though it may have gone out over a holiday weekend, the fact is that the Guidehouse survey that went out was a survey in which the DDAC Self-Direction Committee had some input, and that was really important. And so rather than talk about the timing, we ask everyone to send out to their networks the importance of filling out those surveys, because those surveys are definitely going to be in the summary that Guidehouse is going to develop. I also wanted to mention that OPW has responded formally to our recommendations that we made back on September 23rd. So we're going to go into 2025 knowing that our Sustainability Committee has two very strong recommendations that we intend to continue to work on. One of them is I'm drawing a blank for a second, which is not unusual for me, but it's the checklist that OPW over the years has created. And we are working on bringing them back to to all of the participants as well as the professionals involved in self-direction as a means of creating a more informed baseline approach to what is self-direction and how it best can work. And then the second initiative that we intend to work on is the initiative in which we are taking a stab at trying to reform the support broker training initiative and the experience that people have with their support brokers. I think those are two very large areas to work on, and all of that came through the work that our committee has done during this year. So I want everyone to know that our committee is very active. We meet every month, often more than once every month for our subcommittees. And we're very excited that I think there'll be a lot of really great things coming for next year. Thank you.
Thank you, Stuart. Questions for Stuart?
Oh, the manual. Yeah, actually, Nick, before I jump off, I just got a reminder from Marietta that we should talk about the manual. So we have a subcommittee that's going to be working with OPW and Guidehouse on the manual that will be produced, and we are informed on a regular basis as to the information and data that is going to be populated in the self-direction manual. Bear with me 1 second, Nick.
Language and simplicity.
So it is to make sure that it is addressed in simple language and it is simple to read.
Thanks, Stuart. Stuart, question for you regarding the survey. You said that was there was a question as to whether or not that actually is available. It was sent out through OPWDD.
Yes, it was sent out, and I think that perhaps OPW can answer.
I just put the link in the chat, Nick and Stuart, so folks could see it. We had sent out communication to folks on Wednesday, November 27th, just really promoting the survey and indicating to folks that the feedback is needed by January 6th. But I just threw the link into the chat.
Thank you, Aviva.
You're welcome.
I'll make sure everybody has it who's interested. Anything else, Stuart?
No, thank you, Nick.
All right, thanks. Now we'll move on to systems quality data and service delivery. That's Michael and Dolores.
Can you hear me?
Yes, we can.
Yes, okay, good. So our committee continues to meet monthly. Kudos to the members. We have gotten into a great deal of detail in the past couple of months. So I'm going to sort of give a summary of what we've done for the whole year. So we all know we have a very complex system, right? So we know that people that are seeking services find it really frustrating and confusing, as Tom said earlier. So we spent the whole year really focused on the front door process from the initial contact with OPWDD to service receipt. So we spent time learning about some of the changes OPWDD has implemented and improvements. And we took a deep dive into the processes and the flow of how things, how people experience the system. So what we want in the future is a system that's more transparent, more efficient, and one that supports informed choice making. So that's kind of where we're at. So we took a very systematic approach. We broke into 2 work groups in the past couple of months to try and map out the process. So one group, my group, has been focused on all the details, all the processes and sub-processes of the flow. And then Michael's been working with a group of our members on more of a macro mapping. So this month, in fact, next week, we're gonna pull the two groups together to share what we've come up with. Our group that has been working on the details looked at all the public facing information as we understand it. So we looked at web pages, documents and videos, the front door videos, and we've come up with commentary on all of those things and some questions and some ideas to discuss with OPWDD, specifically Jess and some other members. So any questions on that part of our report? And so we also established a subcommittee that is really functioning as the data community of practice. Michael, you want to talk about that?
Sure. Hi, everybody. So the, Data Community of Practice is functioning as a subcommittee of the DDAC Systems Committee. We have a number of stakeholders from around the state representing, I think, a good diversity of perspectives in the service delivery system. And we're beginning the process with a series of meetings that are really going to be focused on kind of getting everybody on the same page. What are the data capacities of our current OPWDD service delivery system? Where are those data capacities housed? Where are there opportunities to look at where there might be eventual greater data made available in future years? That's where we'll be eventually taking the conversation. But at this first point, we'll have several meetings just getting everybody up to speed. It is highly complicated. There are a lot of moving parts. There are also a lot of projects already in play that OPWDD is working on right now to be able to prepare for the next round of making data available publicly. But our hope really is that this data community of practice eventually, becomes a bit of an advisory group to OPWDD on the spaces where we believe additional data would be most valuable from a systems change perspective and a system in informing the systems change conversation. But it could also serve as a bi-directional exchange of information between CCOs, providers, and OPWDD so that we can all be bringing kind of our respective perspectives to the table to be able to really understand better what we're seeing in the system, what we're experiencing in the system, what different stakeholders are experiencing in that system. So we'll look forward to future meetings over the coming several months here with the data community of practice members. And it's our hope to eventually create more coordination, both with the data systems committee and, the systems committee of the DDAC, but also the other councils and the other committees of the DDAC as well, be serving as a bit of a centralized location for conversations about data requests in future years.
Thank you, Michael. Any questions for Dolores and Michael? Family Support Services, Gail, Kathy?
Good afternoon, this is Kathy. Gail was not able to make it today. So we have our committee on family support services, our statewide committee will be meeting here, the same rooms that you are using at 11 o'clock. There are a number of items that we're going to be discussing. OPW will be reviewing their, we have a $3,000 local council reimbursement fund. And I believe it's the fiscal people who have put a policy and procedure together so that we're all spending money on the same items. This is one consistent way how to get reimbursed for those items that are related to family support council work. We're also going to have an overview about the progress on the RFP. Many of you know that we were allocated a number of dollars and they have been identified by council on how much we would get. We've identified the RFP priorities. Each council has done that. And now we're up to the actual sending out the RFP, reviewing the those who respond and the timeline. And we'll be getting progress on that tomorrow. We also have an overview on the data sharing. There's been inconsistencies across the councils on what data they get in order to do their job, which is to review proposals on an annual basis and also to have knowledge on what's happening throughout the year by reviewing quarterly reports, which are required by the Family Support Program providers. So this is once again a reminder, so we're all in together, both our DDROs and our statewide members and the local council members who are joining us tomorrow will hear exactly what kind of data we should be receiving. There is a long-term plan, but in the short term, until it's all written out and put into policy, we still have to do our job. We're also going to get updates to the site visits protocol, and also our subcommittees. We have a bylaw subcommittee, family reimbursement, ADM subcommittee, community engagement, and advocacy subcommittee. They'll be making reports. One of the things we're going to have is the community engagement did have a conversation at the last meeting about adding things to the FSS website, and we're going to talk about that with the formal request and a vote on what items we would like to have on it. We will also talk at the family reimbursement ADM subcommittee, some information about CDPAP and allowables and non-allowables. And so if you'd like, join us tomorrow, 11 o'clock.
Okay, thank you, Kathy. Any questions for Kathy? All right, thank you. All right, now we're going to just move to open discussion, but before we do so, again, DDAC members who are interested in participating in committee should contact the committee chair. I think, again, all the great work that's being done in the different committees, while the council only meets quarterly, you can see by the many reports in the work that's being done at the committee level that that's where most of the work actually does take place. And we appreciate all of those, both council members as well as non-council members who participate in those committees for all the work that you do in creating those recommendations and facilitating this discussion. So I'm going to open it up for about 15 minutes for general discussion before we start public comment. And again, I would ask people to identify themselves by name.
This is John Morphy in New York. Just before we actually have more open discussion, I did want to comment that this is, at the risk of embarrassing Nick, this is his last meeting as chair of the council. Nick's been part of the council for many years, through thick and thin, and over the last 10 years in particular, he has seen the creation of new committees, the broadening of the council. We now have a much broader diversity geographically, socially, economically, ethnically across the council. It's a long process to make that happen. The appointments process is not speedy, but we're moving in the right direction. What's also happened is we've developed a much better working partnership with OPWDD, which has led to the first 507 plan in, I think it was 12 years. And that work, as you've heard today, that work continues. Excuse me. As Nick mentioned, we have approximately 30 people on the council. We also have about 100 committee members. So herding those cats across all the many differences that arise, the different views, the different opinions, has managed to keep a very high standard of mutual respect and a practical working relationship. When without that sort of guiding influence, I think it might have sometimes spilled into chaos. And he's shown incredible patience with what can be a very sluggish and slow to respond system, and takes the long view on how do we make change effective. Nick has a deep knowledge of the intellectual and developmental disabilities systems in New York. And obviously that work continues in his other capacities, but we will sorely miss that knowledge at the council level. As an experienced professional, he has a unique perspective, but I think what Nick brings to everything is his perspective as a parent, and a viewpoint which governs everything that he does. So we will miss him. I hope you'll miss us. I would also say Nick's colleague, Sandy Radzawan, has always been sensitive to the work that needs to get done. She has managed to be behind the scenes, but gets the infrastructure right. And anybody who's tried to work on the council knows how much infrastructure work there actually is that goes on in the background. She is always supportive, always encouraging, and has been essential to the progress we have made. So I'd like to thank Sandy as well. And to continue the embarrassment, I think Kirk wanted to say a few words and Jeff wanted to say a few words. So Jeff, please go first.
Yeah, sure. Nothing, nothing lengthy. I just, somebody who's still relatively new to the council, a couple of years now, I just wanted to thank Nick for his leadership and, wish you the best.
Thanks, Jeff.
And I'm in a similar place. I'm one of I think the last class to be appointed to the DDAC, but Nick, you've made it real easy to be part of it. I just have great admiration for the job you've done. The term herding squirrels sometimes comes to mind, with the different constituencies and that you manage, and but you've made it real productive and real easy for me to come on. And I just want to second what John said about Sandy, who I think does all the real hard work to keep things organized and running. And, she is in good humor when I send something and say, "Can you send this out?" She sends it out without it beating an eye to getting it to the executive committee. So thank you both for the tremendous work you've done. It's appreciated.
Hi, this is Gary Goldstein. I just want to speak that you just heard from two relatively new members. I think I qualify as maybe the longest lasting member here on the group, through many commissioners, and you've done a great job. You're always available to call after hours, very responsive, very easy to speak with, and very well organized. And I've really enjoyed working with you. And thank you for all you've done.
Thank you. I appreciate all of your kind words and John, and I appreciate you also recognizing Sandy. It's been an absolute pleasure to be on the council. What a wonderful group of volunteers who spend many, many countless hours helping guide and shape recommendations to make the OPWDD system, our system of services, even beyond OPWDD, spanning into healthcare and employment and other services, more responsive to the needs of people like my son and the other 130,000 people who are served by the system. So I really do appreciate the collaboration that we've always received from the administrations over the years, and certainly this one, the work that the liaisons have done to help facilitate the committees, the support of the commissioner, the support of the governor's office. So it's been a pleasure to serve, and I think this is an important, very important body that really is central to making sure that our supports and services continue to help people with IDD live healthy, fulfilling, inclusive lives in our community. So thank you all. Okay. Any other conversation, comments regarding the discussion that we've had from the committees before we move to public comment?
Hi, Nick, it's Kristen Proud. I want to echo what others have said about your leadership of the DDAC on the short time that I've been part of it. Certainly your facilitation of our meetings has been impressive, and I really do thank you for your many, many years of commitment to furthering the field and improving the lives of people that we're all committed to helping here. I did want to make one comment, and Jeff, this is in response to your report that you read from Shamika. And in the spirit of full disclosure, Shamika is one of our council members at the Council on Developmental Disabilities. But for everyone's awareness, the council is funding a current grant project with the Research Foundation for SUNY Farmingdale. and it's related to entrepreneurship. And the activities and goals of the grant project are really to help prospective business owners who have IDD, to expose them to resources and education so they fully understand how they might go about building a successful foundation to start a small business. They, through the grant, provide workshops delivered by the Small Business Development Center at SUNY Farmingdale. And these are offered mostly via their virtual platform, so they're open to individuals beyond the Farmingdale area, certainly. And they're advertising these workshops statewide. It's a 3-year grant project, started January 1st, 2023. It provides individuals who are interested in starting their businesses or learning more about starting a business with accounting, access to accountants, access to legal assistance, who might need support to register a business and make sure that they're following other requirements in order to properly start up and run a business. And one of the deliverables from SUNY Farmingdale is going to be a sustainability plan that we will certainly share with OPWDD when the time comes at the end of this grant project, which is about a little over a year away, in the hopes that these kinds of efforts can be continued after our grant ends with SUNY Farmingdale.
Thank you so much, Dad. It's great to know that the CDD is supporting such an important initiative. And as somebody who did employment work long ago, I know one of the greatest things is to see employers and coworkers out there actually get to know folks with disabilities and what they're capable of. So thank you.
Kristen, thank you for your kind words, but also for sharing that. That's very exciting. Entrepreneurship is certainly an avenue that many people can pursue to, again, lead to successful employment. Other comments? We move to public comment.
Before you do that, Nick, Tom Ebenanti, I'm also a new member, and I want to compliment you and thank you for your service. From what I've seen, you've done a very good job here.
Thank you, Tom.
I do have a question. I have heard of several incidents recently of abuse and neglect in some of the homes. Which one of our committees would take a look into that and work with OPWDD to see if we can try to reduce the number of incidents? Would that be the residential committee, or do we have to set up a separate committee on something like this, or where would we go?
Well, Tom, I think that's it's an issue that doesn't really fall into one of our existing committees right now. And it certainly is broader than necessarily residential. I think what we could do is the executive committee of the DDAC can take a look at that and see where, if it best fits, if it best fits, and then talk to OPWDD. So why don't we take that as an action item for the executive committee?
Thank you, I appreciate that. I noticed that OPWDD has a reporting line for incidents, and then of course there's the Justice Center. I think what I've heard from some families is they're looking for some affirmative action to make it easier for cases to be substantiated. Now that gets into all kinds of issues, whether there should be cameras, whether better training, whether there's better supervision. OPWDD basically does regulation and doesn't do as much oversight. So there's a whole, I think you're correct, it may be more than just the residential committee, but there's a whole series of issues here, and parents are looking for some kind of movement to change the way things are operated. Thank you.
Thanks, Tom. We'll make a note of that and bring that into the executive committee. Okay. Why don't we move to public comment? Colleen? Rachel? Before we move to public comment, again, I just want to state that we will not respond to public comment, but it's very important to note that the council, its members, the committees certainly listen to public comment, incorporate the feedback that we get from the public on issues, personal experiences, issues that they're experiencing into the work of the committees. And again, we urge everybody not to share any information that is sensitive via this forum. Colleen?
Yeah, it was Rachel, so we're gonna start with public comment in person. I think in New York City, since New York City is so full of people today. We'll then move to Albany, see if there's anyone in Syracuse, and then in Long Island before moving to online. Is there anyone in New York City who'd like to give public comment?
Yes.
Yeah. There's one comment my name is Louis Russo. I represent the self-advocacy group in Brooklyn, New York, 175 Lawrence Avenue. Some concerns that I have, make it very brief. One of the concerns I have is the clinic is we don't have we don't get physical therapy once a week. There's no services and wheelchair services only once a month. So we would like some update on you guys to be done about getting these services back with people like myself, PT, OT, and we're not getting it. Thank you.
Thank you. Is there anyone else in New York City?
Okay, I got one. Okay. My name is Stephen Freeman. I'm from the Public Council advisor, council advisor from that community network. And I like to describe we get more service for LC service. We need more we need more college and more service for OPWDD service. And a lot of people at home, they got no place to live because some people stay out in the cold weather and can find home, I guess. And some people the ones to sleeping and outside. They want to sleep inside the residence. That's why people need residents. People need residents for working people, take care of people like citizens, like different staff, get their medicine, get their health care, or get them more service for something, or something. Sometimes you need more healthcare service. Like sometimes healthcare service is not that good because they need more coverage. Yeah, it's a lot of things talk about more about the service we for disability people more. Yeah, and it's not easy for others because you need more coverage for healthcare service, you need more assisted living, place to live. Some people want work. Some people want work. They want work too. Like they say they're looking for work. some people looking for work. They got nothing to take to work. Yeah, and you need more. You need more service for other people working for people for accessibility, for like more accessibility, more. You need more accessibility, more accessibility. You need more we call wheelchair accessibility. You need more of that. And it's not easy for like people come like working like sometimes some people want to go to program, they want to go on accessibility with wheelchair or something like he need more service to get more you need more rest to ride for the accessibility. Yeah. More employment services. Yeah.
Thank you.
Okay, thank you. That's my question.
Thank you. Anyone else in New York City?
Actually, I have a comment. So I feel like one of the great achievement in the past decade is the HCBS settings rule. And I know that New York State is working very hard to be in compliance with the new settings rule. And I want to know how we can see the progress, how those corrective action plans are being addressed and where we are right now, and how do we measure those improvements. So in terms of more rights for people in residences and day programs, more options in the community.
Thank you. All right, in Albany, and we have at least one.
My name is Bridget.
Guys, can you hear me? My name is Bridget. I've been a teacher for 30 years in New York State. And I just wanted to take a minute to really commend this organization, because through the years I've had students utilize the programs here and really benefit them and really so much positive feedback. I can't even imagine, the needs are so great nowadays, so I can't imagine how difficult it is for all of you who are involved trying to meet the needs of such the vast amount of people. So, I just wanted to take that minute to just, I'm well enough. I'm just thinking of Matthew 25 where, Jesus said, people of need, my people, if you do it for the people in need, you're doing it for me. And I feel like this organization is doing it for people in need. And what a godly thing this organization is. So please keep your faith, keep chugging along. I know there must be so much, red tape, and it must be so frustrating, because of the vast amount of needs you're trying to meet, but you're doing a godly thing, and I want to just pray a blessing over this organization, and may you get the help you need, money you need to bless the people. In Jesus' name, amen. Thanks.
There's one more in Albany.
Hey. Hi, my name is Meir Buchner, and I'm the Self-Directed Brokers. I have a couple of points here. First of all, thank you for everyone. A lot of people are traveling a long time, and they're spending a lot of time for these people, and it's amazing to see how people are so dedicated to that. We as brokers are trying to be the most dedicated possible. And we saw, I actually filled out the survey of the guidehouse, and actually I saw that they're not understanding exactly from the way they're asking the questions of how the brokers are working and trying to help these people, but they ask very good questions, and I feel they would rather get a more sense from the open panels, which they will have and understand all the challenges of brokers, because the challenges is not only on the steps on their jobs and the path that OPWDD is assigning and requesting from brokers to done. It's also the communication with all these people in the middle. So I'm very positive for that, and I hope it should move in the right direction. Another point that I want to bring up is that currently OPWDD has a system that comes from the top to the bottom, which they want all the use, they want the APMs and etc. But we as brokers are encountering a lot of issues. It's small changing, which is what I want to say, that soul direction in the concept is a very, very good system. But there are always happening challenges, and the challenges are not as a structural challenges as case-by-case situations, which if it will be a system from OPWDD to fix these issues or listening to the issues and understand what happened and be able to make necessary change instantly, it will be more beneficial for everyone, for us as brokers, the FIs, and not only trying to advocate or speaking to a FI and it should end there. But so what I want to say, it should be a system where brokers could officially have conversations with OPWDD and sharing their input and experience, how systems are, how the issue came up, and what is the good challenge, the solution to fix it. And another point is we, for example, if this is another example, we are having some issues with some regional offices throwing the ball back on the FIs. When the FI is asking a question from their DDRO, they're just throwing the ball back and saying that it's under the agency's responsibility. And the agency is saying that I really want to help this person, but I feel that it's right to do so. But I can't take the responsibility because sometimes the auditors are interpreting the ADMs differently. And when they will interpreting, they're not willing to fight back with that. They would rather prevent from the problem to happen and reject help for these individuals. So this is first of all, it should be as training for the OPWDD DDROs not to throw back the ball back on the FIs and rather answer a yes for a yes and a no for a no, not just to be conservative, just if they understand the ADMs, they should just be willing to write in the email or etc. to help these people. Also, I must say a very big thank for the commissioner. She is very, very listening and want to understand why problems happens and how we could fix it. And she's really, really taking it in. So that's amazing that we never met such a commissioner in the past. Lastly, I will ask from the Self-Direction Committee here in the DDAC to also engage in the brokers chat groups and email groups. There are a few forums for independent brokers, which we are exchanging information, and we feel that if we will have the Self-Direction Committee inside in it, or having, let's say, something, let's say monthly panels, we could elevate our issues also back to OPWDD and having a strong committee which could listen to it. Again, thank you for giving me the opportunity to answer some input, and I wish you a lot of luck.
Is there anyone in Syracuse from the public?
There is not.
Okay. Anyone in Long Island? Gonna see nothing, no. We'll come back to you when we're done with those online. So for anyone who is online that would like to comment, please just press the raise your hand button. We will call on folks in order. You will get a request to unmute. So first up is Roy. And Roy, you just got a request to unmute. Trying again for you, Roy. Roy, you're unmuted.
Good afternoon. My name is Roy Probian. I live on Long Island. And I'd like to congratulate Nick on his 10 years of service. And it's been a pleasure witnessing your grand efforts here. And I know that we will be meeting in the months and maybe years, in my case, ahead. Secondly, I would like to announce that after a very long journey of 60 years, in which my dear bride, Arlene, and I raised our 3 sons with autism and intellectual disabilities at home, have probably utilized every single service that was offered by OPWDD under even its former name. And that my surviving son, my other two sons were lost to the system due to paid and overworked DSP's effort, mistakes. But he and I are still around. And yesterday he was certified in his certified home here at 12 Par Drive in Maniville, where he has lived the last 35 years of his life with me. We raised our sons at home all this time. And it is a wonderful achievement that I have been able to have this accomplished. And I need to thank Willow and Carrie in particular, her predecessor, and all of the staff in the Emerald City, as I affectionately call that place where you work, Willow. And we all know who the Wizard of Oz is, and it's not at 44 Holland, let me put it that way. So this is a great time. Michael's 61, and I started with Arlene advocating literally next year, 60 years ago. So do the math. And I know now that he's safe and secure, and because self-direction for 5.5 years while we tried to make this happen, and it finally has, I can no longer take care of him, and nobody else could do what I do. So this is a great success story, although long, and took some time. But I just want to say thank you, and also to the regional office here in Long Island, particularly Will Cho and Tracy and Lauren Nelson and Tracy Scholl. But having said, oh my goodness gracious, a phone call. I'm sorry.
Call from potential spam.
There we go. Oh,
Call from potential spam.
I'm sorry.
Potential spam.
And thank you, Roy. Next up, we have Mary. You just got a request to unmute.
Sorry, that's my real name that came up. Yeah, I just wanted to ask with the residential committee if there's a way that we could get, they mentioned about there was a reset in terms of what their focus points were and what they would be focusing on in the future, and if there's some way that we could kind of get that information to see what the directions will be going in. I know that they talked about doing a survey with families for certified residences for quality, and I don't know, I'm hoping that that is part of that reset, that we can continue looking at that. And then also, you guys, you mentioned that you have a new charter. If you'd be able to share those things with the committees, outside of the committee, so we can see what we're looking at for next steps. Thank you.
Thanks, Katie. Next up is Ralph. Ralph, you're unmuted, Ralph.
I unmuted. Can you hear me?
Yes, we can.
Okay, great. Sorry. Yeah, I'll put on my stopwatch here so I can keep track of time. Okay, so I'm a self-advocate. I have spoken up a number of times here. I live on Long Island. Right away, I want to comment on the last topic that kind of brought up at the end of the session here on incident management, and put it in a broader context and tie it back to the presentation at the beginning, well, in the middle, I guess, from OPWDD on the CMS access rule. There's a lot more in that than was covered there, although, it was covered very, very well in terms of the operational issues, that you would deal with as an organization itself. But the actual federal effort was broader in the sense of looking at abuse, neglect, and financial exploitation that would cut across a number of those top headings that were presented by OPWDD today. I hope that the committee that it goes to would be systems committee here. It really needs to be dealt with at that level. So quickly, I've had some personal experience with these issues in the past year. I'm not going to go into the personal things. I will just say a couple quick things. One is that the DQI process is broken in the sense that you do not get an opportunity unless you really know how to work things. Like it took me months to get a way to get a written recording of what I present, either as an incident report or a complaint. That needs to be looked into. Probably even more important is that looking at some of the recent educational materials coming from a CCO and OPWDD on incident management, they are, it seems like that OPW is really trying to avoid letting people know about Part 625, which is not under the auspices, meaning those incidents that could be a harmful thing done by anybody. It could be a member of the community, member of a person's family, but it doesn't happen in a certified setting, but it can be very damaging. And that's been, not only is it not the manual has not been updated, that's actually well, not a violation, it's actually a deficiency in terms of the waiver assurances, the CMS for the HCBS waiver. The manual has not been updated so badly that it doesn't even have references to CCOs. It talks about MSCs. So I hope this committee does look into that. The other thing I will say that, I've mentioned a couple times before, and I'm about 2.5 minutes in, so I'll take another 30 seconds, is that we really need to look very carefully at what gets done following the Guidehouse report, not necessarily about managed care itself, but health. The acting commissioner mentioned at the beginning, she prioritizes health. I'm very concerned that the most recent trends in the last 2 years has been to start to squeeze OPWDD services under OMH. We're never going to get to help people like myself with lifelong genetic and other molecular problems. Those are the things that drive us to specialist care, which is less and less available. Even if you have Medicare, as I do, and Medicaid, it's becoming less available. And we have to start with what are the diagnoses, what are the actual data that says a diagnosis is a specific diagnosis. I'm over time now, but I'll end with this, that the reason why no progress was really made with the Guidehouse report is most likely that the governor did not allow Guidehouse, and they're very explicit about this, Guidehouse to look at the cost data and the diagnostic data related to costs of people with OPWDD services and all of their medical services in the basically everything that's reported to Medicaid in terms of all services they're paid for through Medicaid. I hope that the Health Committee and the Systems Committee both look into this and start to press for getting that information from the Department of Health. Thank you.
Thanks, Ralph. Next up is Zora. Just got a request to unmute. Try one more time. Okay. Next up is Hilma.
Can you hear me now?
Go ahead.
Yes. I'm from the Bronx in New York City. I'm an aging parent. I'm 80. My son's lived with me 20 years. He's 44 now. And I'm concerned about the treatment, the very excellent presentation about the access rule. That is that at the local regions, we start collecting data on that's meaningful for us to redirect for planning. What I'm very disappointed about is that the goal of the mission, our mission has been to bring our family members home or to live independently, the best case in the community. Yet there's no reference to how data collection in those settings will be possible for us to be able to gauge what the gentleman that just spoke before me referenced. My son is not only IDD, but has complex medical needs. And since he's been enrolled in managed care, his health has deteriorated because I feel because I have not been able to do the extensive efforts to get appointments and reach the specialists he needs for his highly specialized problems. So if our goal is to bring our young people to a community to live independently or with families successfully, and I'm just so happy that the commissioner focused on health. Most of the care management had always focused just on the home and community-based services, services, and access to health care has not been addressed. My son, the guidepost report had a list of 4 of the areas in which there was most discontent. And I was saddened to see that when the commissioner said that the first people we should approach are the care managers, there was so much snickering across the state. Care managers aren't given the support they need to get addresses, to get into these new barriers to medical care that the pandemic and other economic issues have imposed on access. Parents at home are don't have the training or often the resources. We could make a call to a doctor and we'll be put on a line waiting 2 or 3 hours. In 20 years, my son never got SNAP. I all of a sudden applied for SNAP, and the wait line for SNAP in New York City was 4 hours on the phone. Yet, we'll remember that during the pandemic, when the certified settings were closed, and I have no doubt that in my heart, that Trump has no intention of supporting our children, that they're likely to be sent home with no services. If that happens, we have to, if there is even a possibility of that happening, we need to give more resources to families and individuals living independently. I'm really impressed about the extent to which New York State has made a commitment, but I would ask whether we should prioritize having the state impose those rules and not wait for the federal big government to lock us out of making progress. The pendulum is gone in favor of our children, but once we let it go in an environment like this, it's going to snap back. I pray not, of course. But again, I just had a heart attack at 80, so I see the possibilities short term. And I wish you all the best.
Thank you. Next up is Hilma.
Hi, how are you? I'm Hilma Abreu, and thank you for allowing me to speak. My question is for the committee. I see issue as a mother and as a broker, cross communication with the FIs and care managers, and the way the life plan is written, and the way there is a lack of communications between the care managers in response to the brokers and get things efficiently. And different agencies, they do things differently, and it created a lot of back and forth between the FI, the brokers, and the care manager. Is any possibility for you guys to create a training and make everything cohesive across all FI agencies? Because that is generating a lot of issues. Care managers sometimes come to me and say, oh, this is not all agency work. This is how all the, and it creates a lot of conflict sometimes and a lot of back and forth. How you guys planning to improve that communication between brokers, FIs, and care coordinator, especially when it is come to the life plan creation? Some care coordinators now refuse to create a new addendas or refuse fix their life plan. Myself dealing with this for the past 6 months, I've been trying to reach out my care manager to modify and add my son's seizure on the life plan, and she have not changed that. So that's my question. Thank you very much, and have a good day, everybody.
Thank you. And last is John. John, you're unmuted.
You can hear me, right?
You can, yeah.
I want to make sure I've been having some technical difficulties on my end, so want to make sure I don't mind me on that part. But anyway, I really enjoyed this meeting. You know, I look forward to all the things that I'm hoping to see because, you know, what I'm hearing, you know, I'm hoping to see a lot of that stuff because apparently, you know, what's the best way to word this? You know, I really don't have much at this moment. And maybe a lot of my concerns is, you know, one of the biggest thing is I'm wondering is, you know, I heard something about a committee. I actually chimed in the middle, and I heard something about accountability. And you know, I'm like one of those. You know, I'm not part of any group. I'm just, you know, one of those wild cards. You know, so. But anyway, you know, and I'm a person that's looking for, you know, to get a foothold in this world, and I'm so tired of my care managers, you know, not doing anything, not fighting for me. And I heard something about a light plan on the one before me. I actually, you know, want to add to that because I have that same problem too. My light plan, as we're speaking, has all the wrong information. I apparently, what do you call, has workers that aren't even there, and I explained this to him. All he does wants me to do is sign. And you know, you start to wonder. You know, I may need my help here and there, but you know, I'm not born last year, and you start to wonder. I mean, when I sign this, is this for my benefit, or is this because your bosses are coming up your rear because you need a signature, so you just want to? So I feel like there needs to be a lot of accountability in these light plans because I mean it's a light plan. Also, too, advocacy. I mean, aren't care managers supposed to be advocating for individuals? My care manager, I had to yank his hair just to advocate for me. I mean, long story short, June 14, it's an issue I'm battling with. I was put in the hospital. Someone beat the living crap out of me on my property. And before that, long story short, this is a mouthful, pulled a gun out of me. Yeah, that's a mouthful. I don't think that was something I would ever say before. And normally you would think the guy would be in jail. He was never in jail. So as we're speaking, I'm trying to find a lawyer. I've been trying to find a lawyer since June 14, and I can't find a lawyer. I've been hounding the hell out of my care manager. He keeps saying he ain't a lawyer, he ain't a lawyer. And it's like, I'm not asking you to be a lawyer. I need you to find me a lawyer. Can you help me? And it's like, you know, you wonder why why crime goes on and people get, I mean, you should see the pictures of my face. I literally couldn't eat for a week. I'm surprised he didn't break my jaw. I mean, this is a guy that's still walking free. No charges. The cops refused to press charges. I got all the videos, all the evidence. I mean, normally you would think money's the problem. I'm not worried about the money. It's the lawyer's the problem. As you can see, backwards, you know. I can't find a lawyer. I had several lawyers hang up on me. I don't even know why these lawyers are lawyers. I mean, I think there'd be something to look into for lawyers with disabilities because I find they're all a sham. I mean, they just don't want to help disability people. I mean, my mother, you know, can only do so much, and the care manager keeps passing to my mother where I had to get into an argument with him and say my mother ain't the care manager. She's not getting paid to do what you're supposed to be doing. So a lot of stuff in that area. I feel like this used to be something looked into about care managers helping with lawyers and stuff. Also, too, brokers. And maybe this is going to be, I'm going to extend, a widespread, don't mind me, disparate me on this part about what I'm trying to say here about the accountability. Because I heard, with the group homes and stuff and, about the abuse and neglect. I want to, stretch that a bit to, on a bigger scale to the system as a whole, because I could go on and on, about, there's some good people in the system. Don't get me wrong. There's some people that out there that really want to help. But then there are some people that, you can really tell that really should not be around disability people. And I have reports. I reported most of these people to the point where they're still working in the system. So how am I supposed to trust the system that's supposed to be protecting me if the people are still working there? Like the guy that violated my HIPAA. If he, and FYI, if he violated my HIPAA, who's stopping from violating anyone else's HIPAA? He did to me. Maybe he did to someone else before me. Who knows? But I would put a complaint with Care Design. I guess they're too, what do you call, too more worried about protecting their own than protecting the client. The guy still works there. What a slap in the wrist. The other one went on to work on to OPWDD. Somewhere in OPWDD, I saw when I typed his name in on the internet. The other one still works at Care Design. You hit the, what is it called? The phone, the phone dials, dial in by name. His name still shows registers. So what a slap in the face. And the funny sarcastic part about that is I have him a confession. He confessed to me on recording. Maybe that's the part that bothers me even more. That picture of someone violating your HIPAA, and you have a recording of the guy confessing. Did you or did you not violate my HIPAA? By a simple question. Did you violate? Yeah, I guess I did. And then you got him also too saying, just tell him Josh didn't know what I was talking about. I was out of my gourd. I didn't know. So right there, you got a confession. And I had to go to my assembly member because I had no help in the system that's supposed to be protecting my information. It's right there at the websites and a lot of papers that, that we have the right to, for people, people don't have to know that we're in the system. If we want certain people to know, we don't have, we don't want them to know. They don't have to, I read a lot of that, and here this one guy is sharing it to an entity that I have a lot of problems with, which of course more problems. And so, I feel like there needs to be a big accountability thing. I can go on and on about the HIPAA violation. I'm still trying to tackle that. 2022, and it makes you show you how information's respected.
Well, John, it's Rachel. Thank you for sharing all of that.
Thanks for listening.
Yeah, of course. So I'm just going to turn it, I think that's our last public comment. So I'm going to turn it over to the commissioner really quickly to wrap us up.
All right. Thank you everyone for sharing your thoughts, questions, comments, and for participating. I wanted to add on behalf of the Emerald City, our thanks to Nick. Somebody talked about herding squirrels. I know that we are one of those squirrels. I do think that the DDAC and the time that I have been in and out of OPWDD has gone from being sort of a pro forma, we have to meet quarterly with this group of people sort of thing to something that now is actually very productive, very useful, well respected. We talk internally about, oh, I don't know, let's bring it to the DDAC and get some feedback, right? This is how this committee was supposed to function. And I think, Nick, it's just a sign of your leadership over the last several years. So thank you. And thank you to John for stepping up to take over. I don't think we're actually going to lose Nick, but in any event, I think we are in great hands with John. So thank you for volunteering to take over the herding duties.
Thank you, Commissioner. I appreciate those comments. And John, I know the DDAC is in very good hands. You've shown leadership with both the committees as well as the vice chair. So DDAC is in very good hands to take it to another level.
Anything else?
Great.
Great.
So we will be, I don't think we have the 2025 meeting schedule confirmed yet, but we will be posting that on the OPWDD website when it is ready. And you'll certainly all be getting notifications if you're currently on the email list. With this, we'd like to bring the meeting to an end, and hope you all have a healthy and happy holiday season if you're celebrating this month, and if not, a happy new year. And we'll see you all in 2025.
Thanks, all. Thank you.
Be well.